Hello. Thank you for your interest in this parent training created by the Mystic Valley Public Health Coalition. You can pause the training at any time. This training series is designed to help parents develop a better understanding of effective communication with their children at every age, setting limits, boundaries, and expectations for behavior, how to intervene early on risky behaviors, and how to nurture protections and healthy decisions. This training will touch on developmentally appropriate prevention strategies and tips for parents to begin the conversations about substance use and your expectations and boundaries before it might be a problem. Congratulations! Your child has just graduated high school and is moving on to their young adulthood. Getting them to this point is just the beginning, though. Your child still needs your guidance to navigate the obstacles standing between them and their future. Excessive drinking and drug use is one of the biggest obstacles. It's a serious problem that undermines a young adult's health, safety, and academic or career success for both themselves and their peers. But parents like you can help young adults make safe transitions into independence. If their plan is to attend college, the first step is to choose the right one. Look for schools that have solid alcohol policies in place and are enforcing laws around underage drinking. Students should have access to a diverse range of activities and school outlets along with counseling resources. Take time to read campus newspapers and other local media, making note of references to alcohol, drug use, or celebrations. The first 6 weeks at college are extremely critical and a very vulnerable time for heavy drinking and alcohol-related consequences to occur. Now is the time to keep checking in with them about classes, campus life, and how they might be coping and feeling overall in a new environment. Once away at school, your kids get used to living an independent life, so that first holiday at home can be challenging, but they are still in your home, and thus need to hear clearly your expectations regarding substance use and staying safe. Be mindful and check in with them frequently. The bottom line is that parents do make a difference far past the time of graduation. The research is clear that communicating your values, such as disapproval of high-risk alcohol use, monitoring your teens, and being accessible to them in multiple ways, will make the transition to adult life or college far safer. Numerous studies show that consistent parental efforts to prevent substance abuse through high school and well into college will lower the risk of experiencing related negative consequences. In fact, risks were lower for students where it was clear their parents disapproved of high-risk drinking. They have lots of parental monitoring throughout the summer before college, and that the monitoring continued into the first year. You've got to keep it up to keep them safe. Zero-tolerance messages appear to be the most protective against alcohol use and related consequences, even if students are already using alcohol. In fact, one study assessing parental alcohol-related messages in the alcohol use among students at a university found that parental communication of complete disapproval of alcohol was associated with the safest student behaviors regarding both weekend drinking and any associated consequences. Conversely, parents teaching their college students how to reduce the likelihood of harm if drinking occurs, for example, giving your kids sips of alcohol or practicing drinking responsibly before college, was found to be associated with the highest levels of risk behaviors. Be firm about your stance. 90% of all alcohol consumed by underage youth is by binge drinking, so teens and college students are not drinking in moderation. Set clear rules about no alcohol use and emphasize the harmful consequences of underage drinking. Once your student has settled into college, work hard to maintain a supportive relationship. Keep up with frequent and honest communication and stay alert to possible mental health or substance abuse issues. Know the signs and symptoms of depression and anxiety, as well as signs of problematic drinking that might be developing. And lastly, talk about safekeeping of their medications and about never sharing them with others. Speak to the dangers of taking non-prescribed stimulants, painkillers, tranquilizers, and sleeping medications, especially with alcohol. Each year, there are thousands of cases of negative consequences resulting from drug or alcohol use, including injury, assault, sexual abuse, drunk driving, risky sexual behavior, and death. It's important for parents to truly understand the scope of the problem and not to underestimate these consequences. Exploring the impact substance abuse has on academics, we gathered results from a few recent studies. The first study showed that for college students, moderate alcohol consumption correlated with being late for class, missing class, being unable to concentrate in class, and being unable to complete their assignments. In another study, college students with heavy use of both marijuana and alcohol earned significantly lower GPAs compared to non-using peers from first semester and across the following semesters. In the last study, it found that binge drinkers who consumed alcohol at least 3 times per week were 6 times more likely than their non-binge drinking peers to perform poorly on a test or project as a result of drinking. College is an investment, and frequent or heavy use of substances puts that investment in direct risk. However, the continual influence of parents is a clear protective factor. Discuss some of these adverse consequences with your children. It may make more impact than you realize. Let's shift focus now to substance use among non-college attending youth. At least 30% of emerging adults between 18 to 25 do not enroll in school post-high school. While much discussion surrounds the drinking and drug culture in colleges, this group of non-college attending peers have their own unique set of patterns and risks when it comes to substances. So what are the substances, and how much are they being used? In a 2015 Monitoring the Future study, it was reported that annual use among non-college attending peers of any illicit drug, including marijuana, was 41%. Annual use of marijuana was 39%, with daily use of marijuana at 11.8%. This is more than twice as high as their marijuana-using college peers. When measuring for use of any illicit drug other than marijuana, 19% of young adults report using these drugs. Illicit drugs used at the highest rate include heroin and methamphetamine, while narcotics like prescription painkillers were used by 6% of this population in the past year. Looking at alcohol use specifically, this group is less likely to engage in heavy, episodic drinking, but instead are more risky weekend drinkers. They're also more likely to report daily drinking, which puts them at a higher risk for alcohol dependency. Lastly, of those who do drink daily, consequences they experience can include fighting, driving after drinking, and missing work because of drinking. This is a vulnerable group of young adults, and yet little or no programming exists that targets substance use prevention aimed for them. In many ways, it's left up to community groups, workplaces, healthcare providers, or families to do so. The time to talk to your graduate is now. What about Adderall and prescription stimulant abuse? The National Study on Drug Use and Health found that full-time college students are almost twice as likely to abuse Adderall than other 18 to 20-year-old individuals who are not in college full-time. Adderall is attractive to college students who feel the need for brain enhancement, especially during times of testing or assignments. Desperate students use Adderall as a means to cram for an exam or complete an assignment, as the drug can sometimes improve the ability to focus and stay awake longer. Taking Adderall without a diagnosis has known risks. The first is that Adderall and other stimulant medications can be habit-forming and addictive, especially if used improperly, and it can be very dangerous to withdraw from them if you are dependent. Using Adderall or abusing it in the long term can lead to permanent brain damage because the brain stops producing the neurotransmitters necessary to control aggression and emotions. It also makes them extremely vulnerable for depression when trying to stop using Adderall cold turkey. Talking to young adults about the dangers of stimulants is vital. College students often have no intention of Adderall use becoming a habit, but when it does, they can develop serious issues. Knowing the signs and symptoms is the first step to getting the help they need. Look out for sleeplessness, irritability, aggression, loss of appetite, or increased anxiety. There are treatment programs that exist specific to Adderall abuse. One of the most important things your child should know going into college is how to recognize alcohol poisoning. Each year, thousands of college students are transported to the emergency room for alcohol poisoning. Make sure your child understands how to respond if they or a friend show any signs. Some of the signs include mental confusion, stupor, or the person cannot be roused, vomiting or slow, irregular breathing, hypothermia or low body temperature, as well as bluish or pale skin. Passing out does not mean sleeping it off. The person's life may still be in danger, so it is important to act quickly and call 911. It's highly likely that your child will learn either from online education or through campus programming what the facts are regarding alcohol consumption and digestion. So why not review the facts for yourself as well? Know what a standard drink size is and that it takes about 2 hours for the average adult body to eliminate the alcohol content of just one beverage. Nothing can speed up this process, not even coffee or cold showers. Of course, the safest option is always to drink none or as little as possible. Colleges and universities have a responsibility to follow a set of actions that are effective in addressing and preventing high-risk substance use. Most aim to have a combination of individual and environmental strategies that ultimately support a healthy living and learning environment for all students. Strategies that target all students include requiring completion of an online education program on the dangers of drug and alcohol on campus before registering for classes. Schools also offer education and counseling for when a violation occurs or a concern is raised. Strategies that target the entire campus and surrounding community are policies like prohibiting kegs in resident halls and at tailgating events, and enforcing social host liability laws for off-campus residences. When it comes to campus safety strategies, they can range from ensuring students are held accountable when they violate a policy, to offering measures like a medical amnesty policy that allows a certain amount of forgiveness when help is needed in a medical emergency. Colleges that have Greek life have some additional strategies in place, including requiring third-party alcohol servers at social events, endorsing and enforcing anti-hazing practices, and when violations do happen off campus, working collaboratively with local and campus police to process the response. If problems such as drug or alcohol abuse or mental health crises arise, there are counseling and support services available to students. Before they begin classes, you'll want to educate yourself about campus health services and other possible resources on campus. For example, 12-step meetings or recovery houses and groups. If you or your student thinks substance abuse may be an issue, you can use this brief screening as a self-assessment. It's called the CAGE screening, and its questions are great conversation starters with a young adult who may be struggling. Asking them these questions will determine if there's a possible problem, and if so, you will want to seek out professional help and care. Here are some helpful resources and online tools for parents. Visit our website for more information about what we covered today and to view our other parent trainings. You can also download and print these slides anytime. Thank you for taking the time to learn more about promoting healthy decision-making and behaviors in our children. We hope that you found this information useful, and we encourage you to check out our website for more information.